For everybody out there who's been experiencing wrist pain, pain into their hands, or even into their forearms, I'm gonna show you how you can break up the tight tissues surrounding your wrist joint, as well as both sides of your forearm, to really help you increase the mobility of your wrists and also help you with carpal tunnel-like symptoms. I think it's really important that when people are having tingling and numbness into their hand, which a lot of times people think of as carpal tunnel, usually the only option they're given is surgery. However, most of the time, the cause is actually higher up. In this video, we're gonna show you how you can break up the muscles on the side of your forearm to really help reduce any of that tension pulling into your hand. So this is what I recommend doing on a daily basis. You're gonna start in this quadruped position, or you could do this up against a wall or even onto a desk. But in here, in this position, I wanna first start by spreading your fingers as wide as possible. So as we spread our fingers, we're engaging the tendons and muscles that go up into our forearms. In this position, I want you to think about pushing all 5 fingers into the ground as hard as possible, so that this is an active exercise and not just passively putting strain onto the tendons. As you push down, then in this position, you can start to lean your body weight forwards. And as you lean your body forwards, you'll start to notice the wrist flexors start to pull and stretch. You can move your body to the left, move your body to the right, and you'll notice how that changes the strain into your forearm and wrist joint. In this position, I can then move my elbows in and out, and you'll notice how that will also change the direction of the pull on the muscles in the forearm as well. So I can go elbows in, lean forward, reset, go elbows out, lean forward, and that'll get more onto the lateral outside portion of my forearm. In this position now, I can go fingers away from my midline, again, spreading the fingertips out, squeezing the fingertips into the ground, and then I can lean to the left, lean to the right. As I'm doing this, I will notice how that changes the pulling on either side of the forearm. Now I can go fingertips towards myself, which takes a little bit more of external rotation of the shoulder, so it gets higher up, those chains involved. Again, pushing my fingertips in, and then now I'm going to lean backwards and start to notice how that will pull up into the forearm as well. Now, we don't want to forget about the wrist extensors on the backside. However, I want to make sure you do this very carefully. So I'm going to have you spread your fingers as wide as possible. Fingers are going to be pointing towards yourself. And then as you start to put weight onto your fingers, you might notice that even at this big angle, that you start to get some wrist discomfort. I don't want you to just passively push straight down onto the wrist joints, because that'll put too much strain on the wrist. However, I want you to think about starting to pull your hands forward, almost like your fingers are a paintbrush and you're trying to paint the floor. However, they're not actually moving. So I'm going to engage those muscles by pulling my hands forward. And as I do that, I'll notice the wrist extensors start to stretch as well. So I'm actively pulling, I'm spreading my fingertips to protect my wrist. And then this is where I could also go elbows in, elbows out, and I'll notice how that changes the stretch in various different muscles on the wrist extensors on that backside of my forearm. I can lean my body weight to the right, lean my body weight to the left, and notice how that also changes. So in this position, you got the wrist extensors, you had the extensors and the flexors. Now we can also focus on the thumb. A lot of times people have dysfunction of the thenar joint here, and something you can easily do is give your thumbs a hug, say hello thumbs, and then put your fist back down onto the ground. And now you're gonna lean your body weight forwards and get a really nice stretch all along that medial line that comes all the way up this way from the wrist joint. And so put some weight onto that, come back off, reset, put some weight onto it, and you're starting to notice that this will get a nice little pull on that medial collateral ligament and the thenar joint here. So that is a simple exercise or mobility that you can do on a daily basis to really mobilize all of your joints. If you notice that you have a really tight wrist flexors or extensors on the back side, this will often pull into the fingertips. And so if you sink into a muscle and you notice your fingers curl, or on the back side and your fingers curl down, then you probably have really tight forearms, which is often due to this chronic sitting posture, texting posture or from repetitive type of strains on these muscles. So what I like to do is break up those tissues with a ball or a foam roller or literally anything cylindrical. So a lot of times I'll even use a hard water bottle. But what you can do is find a hard surface, put the ball on it, and then you're gonna put the ball right onto the areas of the increased tension. And so in this position, I could roll very slowly, or I could apply just downward pressure and then allow my wrist to come up. And so if I'm on the wrist flexors, I can apply pressure on the tight spot and then lift my wrist and fingertips up, which will stress or stretch those muscles, which then start to break things up. You can roll to the next spot, pull the fingertips up, and notice how that's really starting to break up the tissues on that front side. If I want to go to the back side, I can flip my arm over, sink into the tight muscles, applying pressure, and then this is going to be the opposite, where I'm going to curl my fingertips towards my forearm, which will stretch the extensors on that opposite side. I can roll to the next spot, apply downward pressure, and then come all the way up. So again, you could do this with a ball, a foam roller, a water bottle, anything to really help to start to break up these tissues. I personally recommend doing a little bit of this every single morning, as well as at the very end of the day if you're somebody who is chronically on some type of device or forward position where your wrist is having to be flexed and your flexors or extensors are engaged throughout the day. Let me know how this helps you. If you have any questions or comments or concerns, please let me know. My name is Dr. Jordan Fairley here at the Source Chiropractic, and I hope you found that this video helps you empower your health.